Hey, everybody, welcome to another episode of the Global Health Impact Network podcast. I'm your host, Martyn Eeles. Now, today we have a really amazing guest who I'm excited to speak with. So, the question we have for you is: have you ever struggled to implement change in your practice? So, I'm here today with Rodgers, who is the CEO of DrDDS Innovations, to talk about how to successfully implement new technology in your practice. So, Travis and his team have actually built 23 different dental software programs that are installed in over 10,000 dental offices. Chances are your practice uses one of his programs he helped build. Travis is also the host of the Dental Innovation Show, and he is the technology editor for Dental Entrepreneur magazine. He is also open to sharing his 15 years of experience of building innovative products in the dental industry and 15 years of corporate technology experience before that. Travis, it's an absolute pleasure to have you here.
Yeah, Martyn, thanks for having me. I'm excited to talk about implementing change. I'm sure most of the people, whether you're a dentist or a doctor, you've gone to a trade show, gotten excited about a new technology, or gotten sold a piece of technology. Come back to practice on Monday, you're excited about it, and it falls short because your team isn't open to implementing it, or things like that. We've all had that. So what we're going to talk about is, the questions I guess that most of the people I ask is, how are you going to implement new technology in your practice? And this applies to dentists, doctors, also businesses, right? We've done over 5,000 personality studies on medical practitioners, and they all fall into a certain category, which we'll talk about that as well, which also talks about, their ability, or I hate to say it, lack of ability to implement or struggle. So it's we have a 3-step process that we talk about: communication, coordination, and conviction. And I'll talk a little bit more about each of those in our conversation here. And I coach my son's flag football team, and last night we had practice, and I was trying to get the guys to do a play, right? I was trying to get them to do, when we were doing a passing play, to do a square route in. And it took them a while, right? And I thought about this. I thought about, just like running a new play out ball field for an 8-year-old, implementing new technology for dental practices can be difficult, but eventually, just like with the guys out on the football field, I gave them some good guidance on how to do that. I laid out the cones. I showed them how to do it. I walked them through it. I talked about the benefits of how to do it. And it's the same thing when you're implementing change in your dental practice, your medical practice, or in your business, is you have a good guidelines. I think a lot of people these days, and more so, and I see this with 8-year-olds as well as all the practices that we work with, they want to know the why, right? And the why is very important. And we all know, no change, no change. If you want things to stay the same, things are going to continue to change around you. You need to keep up with it. And a lot of times, especially we're dealing with what we deal with in today's, a lot of that involves implementing new technology that maybe your team or you is a little bit uncomfortable with, right? So, Martyn, that's what we're going to talk about today.
That's perfect. So why don't we kick off with, how does someone succeed with implementing new technologies in their practice?
Yeah, well, a big part of it is like kind of the guidelines. So you got to understand, what are the personality types of the people? So, like I said, we've implemented a lot of it. The reason why I did all the research on this is we've built over 20 different software platforms ourselves. I've helped launch over 250 different products into the industry, and a lot of the struggle. And there's some great technology. I mean, superior technology to others as well. And a lot of times I saw my the doctors that were implementing this technology fail. And so I said, okay, let's get deeper into this and let's figure out why is this happening. And so what we did is, and I'm a big fan of the DISC personality assessment. And I'm going to give you the 10-second version of this, and then those that are listening can learn more about it. Most dentists and doctors are of the conscientious personality, or the C personality. A lot of times you'll see them between a C and a D, but for the most part, they're C. And the reason why, and it's most of the time you already go into the practice with this concept or with this type of personality. To kind of summarize it, it's a fear of making mistakes. And I always joke, I said, I don't know about you, but that's the kind of doctor that I want to have. I don't want to have a innovative, an I or a D, or a doctor that's not conscientious, that does not have a fear of making mistakes. So, they are in the right category. My fiance is a hospitalist. She's a medical doctor, and it's the same. I can see it every day. She is very methodical with what she does. She follows a process. And it's the same thing with implementing technology in your practice. So, we're going to talk about it briefly here, but those that are interested, you can go to travisrodgers.com and I'll happy to reach out and talk deeper into how to implement this. But, there's a lot of tips. There's the fear of making a mistake, procrastinating on making decisions when you need to make it. That's also part of that C personality type. But the key to it is not just the personality type of the practitioner, but it's also the team, right? So the team is of this S personality type, which really stands for steady, right? Which means that they're very steady. They're you'll kind of see this in the practitioner, the folks that are working as a support person for somebody else, nurses, team members, hygienists in the medical space. So those two personality types are uniquely suited for what they do, right? That's the great news. The bad news is they're not uniquely suited for implementing change and implementing new technology. They're more set for staying as is, right? And as we say, no change, no change. With the practitioners that are successful at implementing change, and I'll just tell you a quick story. One such customer of ours is Brent Boyce of AZ Max. He's an innovative oral surgeon. He's implemented a lot of different change in his practice. And what I really admired about him and why he's a great story is that when he's worked with his team, he's gotten them involved in the process, right? Evolving the team, talking to them, communicating. So this is the first of the 3 C's of implementing change. Good communication, right? Put together a plan, get your team involved, make them a part of the decision. So, what we've seen, and this happens quite a bit, is, and I tell doctors when they buy something, right? You may have already made the decision to buy it, but that doesn't mean you should roll it out. Right? So it doesn't mean you should come Monday the next day. I know you're excited about it, but hold that excitement back. Talk to your team. Talk about the why they need to implement something, right? And I'm kind of keeping this broad. We can get specific into the different technologies and what might the change come, but communicate it. Get them involved. Run an RFP or an RFI, and that's a new concept. I grew up in Silicon Valley, worked at Oracle, IBM. I've done hundreds of RFPs, requests for proposal. Basically, what that means is you're lining up features and functions of various systems. You put it in a spreadsheet. It's very process oriented. It works very well for medical practice, dentists, doctors to be able to implement and follow their process, right? So talk to your team. Say, hey, what do you like about what we're doing today? What do you not like about it? Put together their questions, put together an RFI or RFP, and then roll that out. Look at multiple different offerings that you're looking at. I always like to look at least 3. And then, if you have somebody that's passionate about it, the project from the team, get them involved as well. Oftentimes we see that as an office manager. So communication, that's the first of the C's. Right. Next one is coordination. Put together the plan, put together the coordinated plan of not just selecting the product, but also implementing it, right? So a big part of implementing a product is choosing the right product that has the team involved. But when you talk about implementing it, make sure you put together a plan. Don't all of a sudden just throw it on everyone. Don't make them work nights and weekends just to implement this new technology. Get them, have a clear plan of how you're coordinating the project plan, and putting a basic project plan. There's a lot of different information about that. Again, that's a whole nother conversation. And then the third one is you have to have conviction. The third and really the part that I see a lot of practitioners fail is they're excited about the product. They bring it back to their team. They communicate it. They put together a plan, but they're not enthusiastic. They're not passionate. They don't have conviction that what they're implementing is the right decision. And a lot of times they have a herd mentality in the medical industry, or over here method, type things where they hear everybody else doing something, or they want everybody else to be doing the same thing they're doing. If you want to be successful, it means sometimes you're innovative. Sometimes you're implementing things that are right for you and unique for you. But the third, like I said, third one is you have to have conviction. I thought about when my son learned how to ride a bike for the first time. I was out there and looking out from where I am right now. I bought him a bike, and he took his training wheels off. He was like, "I'm ready to ride, Daddy." And he was down the road a little bit, and he fell. And I looked at him, and I could tell he wanted to give up, but he didn't. He kept going. And I said, "Buddy, lots of tries to get this right." And then he keeps going. He falls again. And then eventually, I look at him, he falls really hard. He's got tears in his eyes. And I reached him down and grabbed his wrist. Or I said, "Buddy, maybe we should try another time." And he said, "No, Daddy, I want this. I want to do this." And I can see in his eyes that he had conviction. And I can see in the eyes of the practitioners that I'm working with when they're implementing change in their practice, if they have that conviction. And I can tell you, that conviction pulls you. There is no easy implementation of change in your life and in your practice. And the most important thing is you have to have conviction. And that speaks to what we talked about from the very beginning. You have to have a strong why. You need to communicate it. You need to have a plan. And then that conviction is what pulls the whole thing through to make it actually possible to implement that change. Does that cover it, Martyn?
It does. Thank you. That's pretty amazing. So, what I want to talk about next is we're kind of seeing a dental integration revolution at the moment. What are some of the things that you're seeing when you're working with dentals?
Yeah, so I've dedicated a lot of my life to the dental industry, and we've done more integrations, custom integrations in the dental industry than anybody else. I don't like it when people their chests and say stuff like that, but I can unequivocally say that we've done it, right? The revolution is coming. It's really here, where we're seeing, especially with the 21st Cures Act that's come out this past year, that basically says you need to make it possible. You need to make it easy to share records with patients, which I think is great. So 7 years ago, I built a product called My Dental Files, which was way before its time, and it failed. And it failed because the world was not ready for electronic health records at the time, and patients were like, "I don't really care about my records, right? I just go to the doctor and that's it." But with the new world that we live in, with the everything being remote, everybody moving from place to place, and the mobile workforce, everybody wants to have access, especially with their mobile phones, to that type of information. So integrate between systems, right? We talk about the dental side, but it's really medical and dental and everything integrating together. So, our product, our integration that we built is built to connect all the practices together, make it easy to communicate, be able to send referrals. We have a product called OneClick Referral that we've built that that was built to really connect, all kinds of medical, dental together to be able to share and collaborate. And you see this. I mean, again, I just a story. As I was walking out to my office here to do this podcast, my hospitalist fiance was inside working on a patient, and she said that the patient just had surgery from another doctor, but she was struggling, and then she's in the hospital now because there was a problem, right? Not to get into the patient detail too deep, but the point of it is if she had the information about that patient in real time faster than where she had it available, she had to fax and she had to do all the process to get the records and whatnot. If that patient or if somebody else had the records in a more of a repository, and let's be honest, we don't want the government to be the one controlling that. We want it to be secure, but not run by the government. But a patient-controlled record comes from integrations, comes from systems talking to systems, comes from really the patient being at the core of everything that we do. And so when I talk about the integration revolution, it's making sure that the practice management and EMR systems make it easier. We've struggled with a lot of them out there just being open to it or charging a large fee to integrate, making that difficult. So the revolution is coming. I mean, I have over 100 different software companies that we work with that we've they're all on the bandwagon for the integration revolution is kind of what I call it. So we can talk. I'd say that's also another podcast in itself, because we all know integration is key to successfully diagnosing, successfully treating, successfully understanding the whole picture of a patient. And I mean, the oral systemic link to the body is very important. I mean, I think a lot of medical practitioners have kind of said, well, that's dental over there, that's medical over there. But the two coming together is what we're seeing. And we'll talk more about that in the future with some things that we're rolling out, including some investments and whatnot that we're making to further that cause. But the integration revolution is real. It's happening. And it's kind of a shout out to those EMRs and practice management systems that it's time that you guys open up. This is not about share. This is about patients' health.
Yeah. So let me ask you this. So what's some of the emerging technology in the dental industry?
Yeah. So, I it's funny because I'm the technology editor for Dental Entrepreneur Magazine. And last issue, I talked about, the most important technology decision you make as a dentist is your practice management system. This month I'm talking about marketing platforms and kind of rebuilding your marketing and making sure it's tied to analytics and ROI. And that's, Dental Entrepreneur Magazine they're kind of getting more on the technology side. The next thing that I'm writing about is artificial intelligence, right? And it's one of those things that I'll be honest with you. So I worked at IBM, right? I used to sell the Watson supercomputer. I have my house was paid for by IBM. Let's just say that. So when I hear talking about AI and artificial intelligence, I was at an integration site today. They called it AI. I'm like, that's not AI. It's painful. So we are seeing AI being successfully implemented on top of imaging. And if you have enough big data, without big data, without a lot of information, machine learning and things like that to be able to cover what truths can be determined through the AI engine, it's virtually impossible. So the imaging is an area that we're seeing where they can look at on an image, and insurance companies are also going to be hopefully implementing this, because the insurance process is broken in the dental industry, and I'm sure it is in medical as well. But the AI is a popular area. So I'd say when I'm talking about, if you're just asking it as a single answer, it's AI. If you're talking about multiple answers, it's also analytics tied to everything that we're doing. So another product that we're seeing and we're working on with some big name dental industry folks is a better analytics platform, right? So the ability for practices to walk out of their practice, open up their phone and see, how did I do today? How am I doing this week? Gamification, making analytics fun, making analytics consumable by not just the dentist, but also the practice, and not just the CPA, but also the dentist. So having versions of analytics that adapt to the user and give them the configurability to have a basic version and an advanced version, and then automatically tie that into their reviews management. So, if you're in the dental industry, we're seeing a lot of another revolution. Another thing that's happening is we're seeing the private practice is going away. So we're seeing two houses in the dental industry. We're seeing those that are saying save private practice, and we're saying those that are, I'm all in on the DSO, the dental service organization, or the groups, right? Medical's been doing it for years. Dental's catching up. So we're seeing a lot of consolidation, a lot of DSOs coming in and acquiring people. And dentists want to know, how much is my practice worth? What's my rating? What's my grade? If I'm a dentist, what is my dentist grade? And so, we have it for our credit score. We have it for just about everything we do. But for the most part, we don't know, is my business an A-rated business because I have good reviews? I have, cash flow that's in the right spots. My revenue is trending up, or, it's in a good place. Expenses are in the right numbers. So a lot more numbers tracking. I'm seeing a lot more savvy business owners in the dental industry, because those that are not savvy are no longer around. So AI, consolidation groups, and better analytics and tracking, those would be the three areas that we're really seeing as far as innovations and movements in the dental industry.
Fantastic. So if a dentist or like a clinic wants to launch like a new product development, how would you suggest they do this?
So, that's a great question. That is first of all, when people come to me, Martyn, I brought this this for you. I call this, I went in my closet. You're a technology guy, right? So I call this my closet of failures, right? So it's like every time if you're at a technology company, the first thing you do when you start a company is you make a t-shirt. So all my t-shirts, all my companies that I've built over the years, right? There's my first one, Mustang Technology, right? Some of these I've sold, some of them, we've taken a couple public, so most of them have failed, right? Let's be honest. 9 out of 10 and probably 99 out of 100 of these new technologies fail. So the first thing I tell people, this is going to sound really funny, is don't do it. And I'm not coming at that from a negative perspective. I'm coming at that from a real perspective, from the point of like, when I say that, I say it cheekingly, right? It's basically, don't do it unless you have the gusto, unless you have the will to survive, because to implement, to build new technology, it's not easy. It's always going to take it. When people say, well, how much does it cost to implement, to build a new piece of software? If there's different ways to go about doing it, so I've built, we're about $2.5 million in development on our platform, right? So we have a integration, database, API layer on top of our applications, right? And then, so we build products on top of our platform. I can build a product for, $10,000 to $100,000 on top of our existing API library. But if you want the whole thing, it's basically a $2 million. If I were to go back and do it again, I could probably do it for $1 million. But it does take $1 million to implement a new piece of technology in the medical and dental industry. And somebody told me that 15 years ago when I started, and it's proven to be correct almost every single time. Minimum of $1 million. And I'm not saying you do it. We've done it through bootstrapping, which is a painful way to do it, right? There's a lot of people that are at a point in their life where they want to give back. And I'm at that point for me where I want to give back to my industry and to other entrepreneurs. So I'm literally building platforms for people where they can take the platform and they don't have to start from scratch, right? So if you want to build an app in that range, it comes with the experience, the technology, the integrations, and I'm kind of like almost doing a business in a box for a CEO or an entrepreneur, somebody that I think has the gusto to get it done, right? So obviously there's a lot of other processes that Martyn, I know I'm looking at the time here, we're at 25 minutes. So the things that I've learned in the process, and I'll kind of summarize this really quickly, is make sure you have a big enough market for it, right? So a lot of times people will build something because they think it's cool, and that's not the way to go, right? So I've gone down a rat hole with doctors that I thought were brilliant, and they were wrong, right? And so don't build it based on just one or two pieces of information or one or two people. Build it on the guidance and input from at least 50 to 100 different people. And that goes for any product you're building. There's a guy named Steve Blank, professor at Stanford. It's called the customer discovery process. And I'm not going to go too deep into that, but that's a great process to follow when you're building technology. Don't be a fool to think that just because you or a couple of your other practitioners say this is a great idea, they're often misguiding you. And I can tell you, I've seen people spend their entire life and go through divorces, going through that process, because you know what? I pull an all-nighter almost once a week, by the way. So just a couple of days ago, it's why my raspy voice, you're up until 3 working with your developers. That is just part of the process. So you have a very understanding, significant other in the process as well. But number one is make sure you got good customer discovery. You got a big enough market that's validated. The money is always a factor, right? Time is also a factor as well. I've worked with a lot of practitioners. I've been doing this a long time, and I had 2 failed projects this year. And it was not, sure, you always get blamed, but the reason why is they gave up. It was both of them were dentists, right? And it's like, they got busy. They bought a house. They bought a new practice. They did other things. They no longer had time. And it's not that the project fails, because it's still there. And as you know, once you build software, the software is there. But they basically just gave up. They didn't have the time. They no longer, and it was not an expensive project. It was like a $40,000 project. And they said, I just don't want to put any more money on it. Maybe we'll pick it up in a year. And it is what it is. So it happens, right? So make sure you have the time, make sure you have the money, make sure you have the will to continue. It's a marathon, not just a sprint. You see that most of the billionaires in the world are software guys, right? So people get excited about it. But I used to work for Larry. I used to hang out with Larry. I shook his hand after 9/11, and I'll tell you what, Larry is a guy that has the gusto. He has what it takes to survive. Look at his age. Look at where he is now. He's got a lot of will. He's got a lot of endurance. So I think endurance to me is the number one factor that I'm looking at as I'm investing in people and in new technology, and also just making sure that there's enough of an audience for that new technology. Third quick one is make sure you're doing plenty of testing your product. QA testing is a big piece. Just because you've tested it doesn't mean it works for everybody else. So make sure you get a lot of people testing it, as well as professional QA testers that are actually in there testing the product. Because you only get one chance for the most with implementing new technology in the medical space.
Perfect. Thank you so much, Travis. I think that's a lot to digest for the people who's going to listen to this. But it's very informative, so we thank you. It's been a pleasure having you on. I know we have another one in the near future where we'll be announcing something huge. So thank you. I really appreciate you coming on today.
To summarize, Martyn, because I love to summarize this, right?
Please
we covered a lot of things, right? We're talking, the topic here is succeeding with new technology in your practice, right? Good communication, good coordination, conviction, right? I think when we're talking about, developing new technology, that's probably a whole nother conversation, right? That we need to have. but it's also part and parcel, because a lot of the people I think that listen to you and listen to me are the entrepreneurial types that want to build new technology, right? And as we talked about there, is make sure you got a big enough market, make sure you got enough people involved, and then make sure you're that are guiding you, and then also make sure you're testing the product. So communication, coordination, conviction, and then obviously there's a lot of people out there that want to help. If people put their ego aside, I met with a guy this morning who's a competitor of mine. I'm like, you know what? I'll work with anybody that wants to further the industry, or anybody that has the will to build a new product. I'm always here to help. We run an incubator, so in the dental industry, it's called Dentcubator. And the Dental Impact Fund is coming up, where we're implementing, we're talking about investing a large fund, a large amount of money into new technologies in the dental industry. And I think what we need to do, Martyn, is probably talk about that on your next podcast.
Absolutely. That was going to be the surprise bit.
Oh, that
you got it up. There you go.
Oh,
there you go, everybody. Travis has spoiled the surprise for you all.
Yeah, there we go. I do that to my kids all the time. They're like, don't tell anyone. I'm like, well, I'm just an open book, I'm a sharer. So
it's fine. All right, it's all good. So,
Thank you so much for having me, and look forward to hearing from you and from anybody that's interested in what we talked about today.
Perfect. Thanks, Travis. And speak to you again soon, okay?
Hey.
All right, man. Stay safe. And then for everyone who's listening, we really appreciate you joining in. Thank you so much. And we hope to see you on the next episode. Stay safe. Bye-bye.